This video describes a new technique of modified MIGS wherein two trabecular bypass procedures have been combined to attain effective IOP reduction in traumatic glaucoma. A 37-year-old patient sustained blunt injury with a cricket ball 2 months ago. His visual acuity was 6/6 but had chronic IOP elevation of 60 mm of mercury in spite of maximum anti-glaucoma medications including mannitol and even paracentesis. His optic nerve head was normal and so were the visual fields and RNFL OCTs. He had angle recession in the superior quadrant. Chronic IOP elevation post-blunt trauma has been attributed to damage and fibrosis of the trabecular meshwork and collapse of the Schlemm's canal, both of which decrease the aqueous outflow. Here I have combined an iStent inject implant with a limited bent ab interno needle goniectomy. The iStent serves to bypass the damaged trabecular meshwork and is placed 3 clock hours apart. Limited bang is then performed for 2 clock hours in between the two stents. The rationale behind this is to viscodilate and expand the Schlemm's canal behind and around the stents so as to facilitate the outflow. Long-term outcome of this technique is still to be assessed, but achieving this whopping decline in intraocular pressure without having to deal with the potential risks, complicated follow-up regime and longer recovery time, and yet sparing the conjunctiva for any future filtration surgery was a blessing for this young patient. Here you see 2 well-placed stents and a well-dilated Schlemm's canal. There were no complications encountered and the patient's post-op intraocular pressure was 10 mm of mercury on 2 anti-glaucoma medications.